This is a global AstraZeneca Young Health program. We're right now working with United Way as one of our lead partners with the Young Health program, along with a number of other key partners, Nemours, Christiana Care, Christina Cultural Arts, the YMCA, Boys and Girls Club, and others. And we're trying to collectively ask that question, okay, how can we build up that whole generation of adolescents so that they can begin living healthier lives and that their whole well-being is something that we're taking into consideration?
I think the world we're in today is increasingly complex for adolescents. As they're getting into middle school and getting into high school, I think the challenges hit them full board. The more we can do to come together to support parents, support communities, support our schools, and support health in the community, the better for our children and our next generation.
From my perspective, if we don't start focusing on our next generation, if not now, when? And if not us, who?
Search Institute has created a list of 40 developmental assets, and they believe that children who possess a high number of those assets, I believe the number is 30, have a better chance of avoiding troubled or at-risk behavior.
Some people will look at the assets and they'll say, you know, this just is common sense, and sometimes we say, well, common sense isn't very common anymore. We have research that show assets matter. Kids with more assets do better in life. They have fewer risk behaviors. All kinds of good stuff happens for kids from all parts of our community.
Kids need an abundance of these assets, and they don't need every single one of them, they just need a bunch of them. And so as community leaders and agencies, we need to be looking at this list of 40 items and making sure that the services and programs that we're providing for kids deliver on those assets.
Taking a community-based strategy that engages key community components, that engages young people themselves, that engages parents, that engages schools, ups the odds of improving outcomes across the board.
You know that cliche, it takes a village to raise a child? Well, this program is designed to build the village. This is something that we as a community need to work on. That community being all of our neighborhoods in this, and all of the counties in the state of Delaware. And who does all the work? All of us do the work, and that's the goal.
It's the synergy that comes from partners working together, each of us bringing our own resources to the table and combining so that there's a explosion of look at what we can do together. It's not about a single organization, it's about the kids.
If each of us works to a common purpose, this ends up in not just a utopian vision, but very practical levels of high achievement. So that's a recipe for success. Healthy communities are made of healthy individuals. I say health in the most holistic way. And the Young Health program, I think, offers huge potential for our community and for communities like us.
Our young people are among Delaware's greatest assets. We have an incredibly important opportunity to protect their health and improve their quality of life, now and in the future. Join us and be an asset for adolescents in your community. You'll be helping your children, and you'll be helping your community's children.